The scenario that we'll be acting out is that Mrs. Metcalf has a student named Ben who has tantrums and sometimes has property destruction during math class. Math is a difficult subject for Ben and it often takes him twice as long to complete classwork as other students. After a baseline collection of the frequency of the behaviors, a plan was developed by Mrs. Metcalf and me. The plan was to use functional communication training during precursors to the behaviors of tantrum and property destruction to replace those behaviors with asking the teacher for a break. The plan has been implemented for 1 week and Mrs. Metcalf was observed yesterday. Hello, Mrs. Metcalf. How are you?
I'm doing well, thanks. How are you?
Well, thanks. Thank you for meeting with me today. The purpose of this meeting is to go over the implementation of the functional communication training plan that we developed for Ben. We will talk about the observation session yesterday and go through the implementation checklist.
Okay.
To start, I want to ask you about how you feel the plan is going for Ben. Do you have any questions or concerns about the plan?
So far, it seems to be working well. Ben has had less tantrums and property destruction with the week that we have been working on functional communication training.
That's great to hear. I was looking at the behavior data of tantrum and property destruction that you collected before this meeting. It looks like both behaviors have decreased dramatically since the baseline period that you collected data in. It is so helpful to be able to look at that data and see where the behaviors were at before the plan was implemented and where they are now. Thank you for taking time to collect that data.
I agree that it has been nice to look at the data to see that the plan is working. I am worried about how often Ben is asking for a break.
I understand that is a big concern. Right now, Ben is learning to communicate his needs to reduce the maladaptive behaviors. The maladaptive behaviors have decreased substantially with this plan. After a little more time, we will lessen the amount of breaks he can receive. We just need to see a bit more consistency with him independently asking for breaks before changing the amount of time he is allowed to take a break from his work.
Okay. He is showing so much progress in communicating his needs, and on Monday he asked for a break with his group work and reading when he started to get upset all by himself.
That's great. He is using what he learned and applying it to different scenarios. Go, Ben.
It's awesome.
Do you have any other questions?
No, not right now.
Okay, well, let's take a few minutes to go over the treatment fidelity checklist together. Please stop me anytime if you have any questions.
Okay.
Treatment fidelity is super important because it shows that the plan is being implemented with the correct design. It leads to accurate data, and the better we implement something as designed, the better progress the kids can make. So to review the treatment fidelity for Ben's plan, the first step is to present the task. The second step is at the site of precursor behaviors, prompt Ben to ask for a break. The third step is to reinforce the asking for a break with social praise and a 30-second break. And the fourth step is to reintroduce the task after the break is over. And from the observation yesterday, you did great presenting the task at the site of the precursor behaviors of whining and forcefully tapping his pencil. You intervened quickly and prompted, "I need a break." It was awesome to see that this occurred spontaneously 2 out of the 7 times he independently asked for a break. Allowing Ben to receive a break right after his statement reinforced the statement, which will help increase the behavior in the future. You also gave great social praise every time he said, "I need a break." Good job with this step. The one note I had about fidelity of implementation was that some of the breaks ran a little long. It is important that they are short breaks and then he gets right back to his work. This may be a difficult part of the plan, as discussed before. You have 17 other kids in the classroom and your attention is often divided among the others.
Yes, this is often difficult as I have questions to answer from other kids and directions to give.
I know you're super busy throughout the whole day. It is hard to spend extra time with one kid when all of them are needing attention and feedback. Think back to when the behaviors were occurring, though. This 30-second break and prompting of "I need a break" is still likely consuming less time than the maladaptive behaviors were. Hopefully, with continued time and increased independence, Ben will require less and less breaks. So keep the breaks shorter and closer to 30 seconds and is an important part of the plan. We want Ben to take a few seconds to calm down and then get right back to his work.
Okay.
The final step is the reintroduction of the task. The step was implemented every time. Do you have any questions or concerns about the feedback of the fidelity of implementation?
I don't think so. I'm excited to see his continued success with it.
He's doing so well. Great job recording the frequency data for when those behaviors do happen. That will help to know how the plan is going and if we need to adjust something in the future. You do such a great job understanding when Ben starts to get frustrated and intervene quickly and effectively.
Thank you.
Thank you for meeting with me today. If you have any questions or concerns, please let me know.
Okay, Will. Thanks.